Hi, I'm Alec Delancey, psychologist, and I work in the field of education and mental health. Today's topic is generalized anxiety disorder, physical and behavioral symptoms as observed in children and teens. Keep in mind, the statements made here are based on my views or opinions, as well as research I will have done for this video. I will put the links in the description based on my research. The content presented here should never be used as a substitute for direct medical and or psychological advice from your doctor or other qualified clinicians. This video is based on my personal desire to bring to consumers the science behind mental health and related behaviors. So let's look at the topic of generalized anxiety disorder, physical and behavioral symptoms as observed in children and teens. Keep in mind this video does not cover all the information dealing with the subject or the topic. We will explore in this video some normal feelings of stress children and teenagers may experience. I will also briefly highlight a few other disorders with anxiety as a presentation. This will help with context. I'll also talk about what generalized anxiety disorder is. We will also look at some definitions and that will help us out a whole lot. And then we will talk about some symptoms of generalized anxiety disorder in children and teens. We'll also talk about some other medical conditions which can mimic generalized anxiety. And we will also talk a little bit about what parents or caregivers can do to help their children or their teenagers. Now, keep in mind it is normal for a child or a teenager to experience some level of stress. That's totally normal, and especially if they live stressful lives. For children and teenagers who are in school, that could be quite a bit of a challenge for them. It does bring with it some challenging moments. They have assignments to complete, exams to do, group projects to work on. There are new things that they have to learn, things they have to memorize, and even navigating relationships with teachers, relationships with other students, that could become a little stressful at times for a child or for a teenager. Then there might be situations of economic challenges where the child or the teenager may have to actually work. And when I talk about work here, work to support the family, they may have to actually be in a grocery or a shop or something like that to support. Sometimes it's a family business, and the child may actually be involved in that business to support the family. Or they may have to do without some kind of material things, and that could bring a level of anxiety for a child or for a teenager. They may have to do uh, without probably going to the mall and probably buying some of the new things that other children or other teenagers may actually have access to. They may actually not have access to certain needs, or the access they may have, it might be limited. So for example, access to new clothing or new shoes, that could be a little stressful for a teenager if they don't have those things and it's a need for them at a specific time. In a situation like that, sometimes a family member or a family may have to decide as to whether or not to send their teenager or child to get something new, like a new piece of clothing, as opposed to buying food. So sometimes that is a bit of a, a challenge there that the family may experience, and that can bring on some anxiety for a child. That could bring on some stress for a teenager. Or it might even be a health situation where the child or the teenager may actually be experiencing some health challenges, and that could really create some anxiety there. Now, these could definitely make a child or a teenager feel a sense of anxiety, feel a sense of worry. However, yet these situations may not necessarily be categorized as uncomfortable as they may be. They may be not categorized as a disorder. Yes, it brings with it some negative emotions. Yes, it brings with it some stress, but it may not actually be considered a disorder. It may just be considered some level of normal stress that comes with these situations that were just spoken about. So, we want to talk a little bit about anxiety in the context of other mental health challenges or disturbance or even disorders. So there are levels of anxiety that may be seen in a person who may actually have a panic disorder. There are anxiety levels that you will see in a child or a teenager who is experiencing some level of phobias. So, for example, agoraphobia, where the person might be afraid of leaving an environment. So they may actually be in their homes and they're afraid to go out, afraid to go to school, and that can go on for days or weeks or months, sometimes even years. That brings with it some level of anxiety. And you may also see levels of anxiety seen in claustrophobia. The person may be afraid of enclosed spaces, so you see anxiety there. Even post-traumatic stress disorder, social anxiety disorder, obsessive compulsive disorder, you will see levels of anxiety demonstrated or presented in a child or a teenager. Yet, what is generalized anxiety? Now, this is where we have to pay close attention to the difference in the disorders or situations that were just spoken about, such as the phobias, post traumatic stress disorder, social anxiety, obsessive compulsive disorder, panic disorder. Here's where we're going to look at the difference of generalized anxiety disorder when compared with these others that were made mention of. Now, generalized anxiety disorder is really excessive, ongoing anxiety or worry that are difficult to control and interfere with day to day activities. And this may actually be a sign of an anxiety disorder. Now, this is according to Mayo Foundation of Medical Education and Research. But we need to be a little more specific here now as to exactly what generalized anxiety disorder is. So that definition gives an overview of what it can be, but a person may be a little confused. They may say, well, isn't that kind of excessive ongoing anxiety and worry not seen in social anxiety disorder, for example? What's the difference between generalized anxiety disorder and social anxiety disorder? Well, here's where we will get a little more specific. Now, generalized anxiety disorder is a long term condition, so it's long term, that can cause you to feel anxious about, and take note of this, a wide range of situations or issues rather than one specific event. So we see the difference there. It's the feeling of anxiety over a wide range of situations. So it's not just one specific issue, such as claustrophobia or agoraphobia, that the person might be experiencing, or anxiety over being in a social setting and that's it. No, this is a wide range of various settings and experiences that brings about this anxiety, this generalized anxiety in the child or in the teenager. Now, according to another reference work, and this is taken from Children's Hospital of Orange County, it says that generalized anxiety disorder is defined as chronic excessive worry and fear that seems to have no real cause. Children or teens with generalized anxiety disorder often worry a lot about things such as future events, past behaviors, social acceptance, family matters, their personal abilities, or school performance. So we getting that sense from that definition from what is made mention of by the Children's Hospital of Orange County, that generalized anxiety disorder is really this anxiety or worry over a wide range of situations or or events that the child or the teenager may be experiencing or a part of. Now, to talk a little bit about how this generalized anxiety disorder can manifest itself with children and teenagers, let's look at behaviors and see how it affects them. So, for example, you may see perfectionism demonstrated. You may also notice that in the classroom setting, the child wants to always be perfect in a response, perfect in a written assignment, perfect in their homework, and they will redo it again and again to make certain that they feel that what they're producing is the best possible work, and they want you, the teacher, to also feel that that's the best possible work they can produce. Now, every child should probably want to produce the best possible work that they can. However, with generalized anxiety disorder, the child or the teenager who is experiencing that, it goes a little beyond. This is where they obsessively try to get things right, and it can cause them high levels of stress, even outside of what you as a teacher may think is necessary. So they really want to do their best and they obsessively stress over getting it right. These children or teenagers may also lack confidence and they constantly want to be reassured. So they will perform tasks either at home, maybe it's chores, or probably in the school, perform these tasks, and they will constantly try to get your feedback on it. Now, again, you may say, well, okay, a child who wants to get feedback on a task, that's good. But this is not just get feedback and move on. This is, I want you to say the right thing, and it has to sound a specific way. The feedback has to sound a specific way to comfort them. So they're lacking this confidence, and they will constantly ask either you, the teacher, maybe ask their friends, maybe ask an assistant teacher, probably ask the principal, maybe ask the dean. So this is a constant trying to get reassurance. And in the case of the home, they do a specific task, but they will constantly be asking the parent or the caregiver, is this done properly? How to improve? What to do next? So it's like, I want you to give me that kind of attention because I really lack the confidence in what I'm doing. Now, you may also notice another symptom might actually be they avoid school, they avoid social situations. And this is interesting because if a child is school age or probably they are still in school, you want them to be there regularly. You want them to be able to learn and focus and concentrate on the specific subject matter that they're engaging in. But here's a situation where the child does not want to go to school and they may actually have high absenteeism. So they may start experiencing dizziness or heart palpitations, and they will say, I can't go to school because I'm sick, I'm not feeling well, I'm feeling really drained today, I'm feeling tired, I can't concentrate, I have a stomach ache, and they may have these physical complaints. Now you may take them to the physician to check them out, and the physician may not necessarily find anything wrong with them, but yet these physical experiences, they will talk about it a lot: the dizziness, the headaches, the heart palpitations, and the pains in the chest, the belly aches, and so forth. So these are some manifestations that you can possibly see in a child or a teenager who is experiencing generalized anxiety as a disorder. Worrying. Worrying is something that definitely is a presentation. They worry about things that has happened, did not happen, or might happen. There might be some fears about their safety, wondering if maybe they might be attacked if they go in an environment. They may be thinking that their parents might be attacked or they may lose their parents to some accident, so they worry about that. They may worry about if they are not in the presence of their teachers, or they may worry about if they're not in the presence of their friends. So it's an interesting kind of presentation in generalized anxiety, and it could be quite tricky at times for a clinician or physician to actually diagnose a child or teenager with generalized anxieties. Sleep disturbance is another situation. Sometimes the child may be awake for long hours during the night when they probably should be at sleep, getting their rest for the next day. Or they may actually not be able to just fall asleep, but they may be actually sleeping quite a bit. So instead of staying up, they actually sleep during the day, sleep during class, they fall asleep very easily. And all of that could actually be a manifestation of generalized anxiety disorder. Clingy behaviors, and this is where it appears that there's attachment issues. So they cling to the parent, they cling to the teacher, and you see that kind of anxiety when that person that they may trust is not in the room with them. They may actually feel like they are abandoned, and they may start to worry and get all stressed out over not being in the presence of that individual. They may actually also be easily startled, and that's interesting because they may have challenges concentrating, but if they are able to concentrate and they're focusing on something, and maybe someone comes in the room, maybe come in their bedroom, or probably a parent coming to see if they were asleep or something, they may actually jump and be easily startled. Or if the teacher is walking around in the classroom just checking books and so forth, the child may actually not recognize the teacher is close standing next to them, and when they finally recognize that, they may actually jump or become startled, or become fearful of the teacher who is standing next to them, not recognizing that they may have been daydreaming, or maybe their focus was elsewhere. So, generalized anxiety symptoms in children and adolescents, it's a interesting combination that can present itself, and because of that, it could actually mimic other medical conditions. And there's where the physician and the clinician needs to really be observant, really be clinical, really do the assessments necessary in their various profession to figure out what the problem or the situation may be. Now, generalized anxiety symptoms in children or adolescents may actually resemble other medical conditions or even psychiatric problems. So there's where it's really important for the clinician or the doctor to do assessments and tests to figure out if it's really generalized anxiety disorder, or if it is actually a medical condition, because sometimes medical conditions can look like generalized anxiety disorder. For example, there might be a hormonal imbalance, and that can look like anxiety disorder, but it may actually just be a physical condition or medical condition, and not a psychological condition. So, for example, you may have a child or a teenager who may have overactive thyroid glands, and this can actually speed up metabolism, and it could lead to nervousness, restlessness, fast heartbeat. And we spoke about that kind of presentation a little while ago when we were talking about the presentations you can see in school. So it can actually be a thyroid problem and not generalized anxiety disorder. And if the generalized anxiety disorder is being treated by a clinician without having a medical done on the child to discover that it's really not just generalized anxiety disorder, it's actually a thyroid problem, you may actually recognize that the treatment plan may not be successful until that child receives a medical and given the appropriate medication for the thyroid issue that they may be experiencing. Some teenagers or children may also have another medical condition, and it not be generalized anxiety disorder. For example, adrenaline dysfunction can look like generalized anxiety disorder. Electrolyte imbalance. Here is where the levels of electrolytes such as sodium or potassium, it can actually cause anxiety-like behaviors when it is high or even when it's low. So this might include things like shortness of breath or confusion in the child or the teenager, as well as rapid heartbeats. So the electrolyte imbalance, when fixed by given medication, the symptoms could go away. But if the child does not receive a proper medical, it can look like generalized anxiety disorder and the diagnosis be wrong, and therefore the treatment be wrong. There are even situations where another physical condition, such as lung disease, this can manifest itself where the child shows shortness of breath, they appear to be anxious, they experience nauseated feeling, maybe chest pain, chest pressure, and it could be lung disease and not generalized anxiety disorder. Even polycystic ovarian syndrome, PCOS, can be a condition that a female may be experiencing, a child or female teenager. And this can actually look or present with symptoms of anxiety. So you may actually, the child or the teenager may actually experience headaches or sleep problems, mood changes, even depression. So these are just a few medical conditions that could mimic or look like generalized anxiety disorder. Now, this isn't to say that a child or a teenager who is experiencing generalized anxiety disorder cannot also have these physical medical conditions. And that's why it's so important for the doctor, the doctor that is doing the assessment, and the clinician who is also going to do some assessment, to kind of work together in a kind of multidisciplinary way so that they can figure out if it's simply generalized anxiety disorder, or it is simply a medical condition, or if it is both. So it's important to always consult with a doctor and or a qualified mental health professional for a diagnosis. Now, in most cases, generalized anxiety disorder can improve with psychotherapy or CBT, and this is cognitive behavioral therapy, or medication. So it could be a combination of talk therapy, counseling, and medication, or it might simply just be therapy, cognitive behavioral therapy, that will be necessary to help the child or the teenager to be able to improve, to cope, to learn how to relax, so that the symptoms that are presented in generalized anxiety disorder can actually be reduced. And so, for example, if I'm working with a child or a teenager, I will do a psychoeducation on anxiety, for example. So helping the child to, or the teenager, to kind of get a sense of what they're experiencing, what is anxiety, how it presents itself, so that that kind of education reduces the fear or the worry, because they now understand that this is a situation that not just them alone experiencing, but other persons can experience it, and this is probably the reason why they're experiencing it, and what are some of the strategies or techniques that can be used to reduce generalized anxiety disorder. So those are some of the anxiety psychoeducation that I will do with a child or a teenager. Of course, based on the cognitive ability of the child or the teenager, it will be age appropriate. We'll use a lot of illustration, examples, and stories to help them to get a sense of what they might be experiencing. We'll also attempt to challenge negative thoughts. And sometimes what happens because of the negative thoughts that comes with the generalized anxiety disorder, it has to be challenged. So we will be looking at the evidence for why they are perceiving that, for example, something bad will happen to them. Why are they perceiving that something bad will happen to their family? So those are some of the challenging. Those are some of the things we'll do to challenge those thoughts. We'll look at the evidence that is presented, and many a times, what the child or the teenager will discover is that some of the fears or the anxiety that they are experiencing internally might not have a basis for actually happening. Also, to working with a child or a teenager using CBT to help with the generalized anxiety disorder presentations, we'll do some exposure. So we may be in a very controlled way. I will expose them to some of the things that might be contributing to their anxiety. So, for example, it might be that if they are fearful of a number of things, so they're fearful of going to school, they're fearful that something will happen to their parents, they're fearful that if they leave the home, then something bad will happen to them. They probably are afraid of eating a specific food. So all of these things over a period of time, working with that child or that teenager who is experiencing generalized anxiety disorder, I'll be exposing them to eating some of the food, exposing them to going out. We'll be talking about if they make a step towards going outside, if they just get their clothes ready, their school uniform, if they put the plate with the food in front of them, I'll expose them to some of these things that can trigger the fear or the worry or the anxiety. And then we'll talk about the feelings that they are experiencing. We'll also talk about the possibility or the evidence for, is this that bad? Is it that anything has happened so far to you? What are you experiencing? So those are some of the things that we'll be talking about. Relaxation skills. We'll talk a lot about relaxation skills if I'm working with a child or a teenager who is experiencing generalized anxiety disorder. So a lot of breathing techniques will be used, some self-soothing. I'll help them to use some self-soothing gestures so that they can actually start feeling a little relaxed. We'll do some things involving imagination and visualizing some calming events, some calming situations. So these things will be guided and it will be age appropriate and it will be in a controlled way so that the child or the teenager who is experiencing generalized anxiety disorder can start coping, can start relaxing, can start learning about what is going on with their bodies, what is going on in their minds, so that they can develop over time some level of control. So I hope that this video was informative. As usual, it was a pleasure talking with you. So you can like, subscribe, and you can also share this video with another person. All the best. Take care.